Hello, everyone, and welcome to Greater Living, GBMC's Greater Living. I'm Mary Beth Marsden. Thank you so much for being with us. I want to thank everyone in the studio audience who's here and everyone who's watching online. We continue our conversation about probably the biggest talked about topic in the new year. How do I lose weight? And that's my resolution, and I've failed every year, and weight loss is a huge issue. And so we're going to talk about many issues involving weight loss, how we do it, and how bariatric surgery can play a role for some people who are in that battle, and there are a lot of us there. So I'm joining us now is Dr. Dovak, Dr. Betsy Dovak, who was here in the last hour, and now Dr. Timothy Friesen, her colleague, joins us too, both bariatric surgeons at GBMC, both have amazing stories. And also I think, when I think about bariatric surgery, I just think there are more misconceptions than people really know what it's all about. And I just want to just take one right off the table. I think when we talk about obesity, people who need to lose weight, people who are trying to get healthier, people who are considering bariatric surgery, there is a certain segment of the population who say, that's so weak. Why can't they do it on their own? Why do they have to have surgery? And there's this terrible stigma, probably not as bad as it used to be, maybe 20 years ago, but I think it still exists and people don't want to talk about it. And it's a wonderful, wonderful tool in the race to get healthy. And
you're starting me off on my biggest pet peeve ever.
Get on
and
it,
I just
girl.
have to say this. Let me tell you that. Let me ask, if your mother out there, these people who are saying this, if your mom had breast cancer and the treatment was prescribed that she should have surgery, chemo, radiation, medication, whatever it is, would you tell her that's the easy way out? No, you wouldn't. It seems ridiculous almost. I heard a laugh in the audience because it is ridiculous. Obesity is a disease that is very devious and is very difficult. It is very complex. But what I get to see in my career is that it is a disease that we can help treat with the proper tool, as you said. So let us just start off with that misconception and breaking it down that this is an amazing, amazing, amazing treatment for a really tough disease.
yeah, and Dr. Friesen, I wanted to kind of put, not to start on a negative note, but I wanted to kind of put that out there just to wipe that off the table.
Yeah, and I think the other thing is that it's really not a disease that's rare. If you look at statistics, about 2/3 of Americans are overweight, and 1/3 of them are actually obese. So it's a very, very common disease. Now, we don't treat everyone who's obese. You actually have to be morbidly obese. You have to have a certain BMI. But that still affects millions and millions of Americans. So you're not alone when you're in this situation.
And for some people, it is easier to lose weight than others. It's
Definitely.
we're not all created equal in that
Very
way.
true.
So there's a little bit of repetition that we're going to have to happen because we have people joining us now in this hour talking about weight loss and surgery. And so I just want to break down, and you both can jump in, feel free, but just give us an overview of where we are now with bariatric surgery, the different types and so forth.
Yeah, so there's basically two big categories of bariatric surgeries. There are surgeries that are considered restrictive, and that's a sleeve gastrectomy. It's basically a procedure where you just make the stomach smaller. So we remove about 80% of the stomach, and what that does is it allows you to not be able to eat as much food in one sitting. There's also a reduction in your appetite, which is pretty significant after a sleeve. So that would be the restrictive type of bariatric surgery. It's a sleeve gastrectomy. The other one is a gastric bypass. And gastric bypass, you also have a smaller stomach. So there's a restrictive element, but there's also a malabsorptive element, which means that all the calories that you eat, not all of them get absorbed. And that's achieved by making your intestines shorter. So you don't absorb all the calories because the portion of the intestines that you're using to absorb calories is shorter.
Is one more popular than the other?
So the gastric bypass has been done for much longer. So it's been done for several decades, whereas a sleeve is something that just came on a little bit more recently. So if you look at around there, how many people have had a gastric bypass, it's probably more common. But nowadays, I would say if you looked at all the bariatric programs, there's probably a little bit more sleeves being done. But we kind of have this debate between myself and Dr. Dovak. Each surgeon sort of has their preference.
Well, I'm curious, if the gastric bypass was sort of what you did,
Yeah.
and the sleeve came along, why would the need for the sleeve? What does that do that the gastric bypass wasn't doing?
So, a sleeve is definitely, I don't know if the word invasive is always, very well understood, but a sleeve is definitely a smaller procedure, I would have to say, because you're really just removing a portion of the stomach. There's no reconnection of intestines with the stomach or intestines with another portion of the intestines. It's also a shorter procedure. So for some people who may have more risk factors associated with a longer surgery, for example, if you had a very high risk of a blood clot or something like that, where a long surgery, or if you had more risk factors in terms of your heart, a shorter surgery might be better. But really, the way you choose between a sleeve and a gastric bypass, one of the main factors that you have to consider is something like acid reflux. So acid reflux is actually cured by a gastric bypass. So patients who have severe acid reflux actually are probably better off having a gastric bypass. I would say that's one thing that's pretty much a definite. There's other things like severe type 2 diabetes. Patients who have severe type 2 diabetes, for example, if they've been on insulin their whole life, or everyone in their family has diabetes, even their dog has diabetes, those people probably should have a gastric bypass as well, because there's an effect of the food actually not going past the pancreas that seems to have a very beneficial effect on blood sugars and on your ability to get off of insulin.
I have to say, when you mentioned about the sleeve, and I understand that it's a personal choice based on what your issues are,
Yeah.
but when you mentioned the acid reflux, which I'm sure a lot of people have suffered from at some point and maybe do chronically, can you not be overweight and still have acid reflux and still benefit from the sleeve?
Sure. There's many ways to benefit from the sleeve. I mean, the main one is weight loss and improving your health in general.
But that might not be your main issue for getting it. Is that correct?
Sure.
That's interesting, because I think we have a notion that that's the only thing it serves, but really it can do many-fold things. We have some questions. I want to make sure we get to those because I know some of those have been missed. Hi.
Okay, is it on? There we go. Okay, so our first question is from one of our audience members. She asked, what kind of post-bariatric support is available at GBMC, such as nutrition guidance, psychological support, exercise, etc.?
So we pride ourselves in offering a lot of support, and we hope it's maybe even more than a lot of other programs do. We utilize social media. Because probably chances are most of you, if not every single person in this room, has a phone, probably on them, a smartphone. And we do a lot of things on Facebook, which might sound silly, but like I said, we have this group, this secret group, in which you can join and be honest and raw, because again, you can't find it, so it is a good place to be safe. And we also, we offer other things. I'm on Instagram, Dr. Dovec, DRDOVEC. If you want to follow me, you can direct message me anytime. If you want to Facebook friend me, I'm Elizabeth A. Dovec, and you can privately message me anytime. Dr. Friesen will answer you. We'll answer you because we want you to know that we're there, we support you. And then at our program, we have a registered dietitian. Her name is Jana Wolf. She helps. We utilize an online program called newtry.health.com, and anyone can check that out as well, and it gives you all the robust education you need. And then we also have a good collaboration with local psychological mental health care providers that would be happy to help you with that mental aspect too. And we team up with Brick Bodies. We'd have our Comp to 5K initiative. We have so much going on. It's only up for you to take up how much you want to do to get involved. So we hope that you'll take advantage of all of our resources all the time.
I'm curious too, do you have patients who might come in and they're considering weight loss surgery, but maybe they're not quite there yet? Because I know it's a big decision to try and do surgery. Do they participate in some of these programs before surgery?
Sure. I mean, we have a complete program, and some patients we actually treat, So you have to be able to qualify, and that's something we didn't really talk about too much. You do have to have a BMI above 35, And if you actually don't have diabetes...
Don't try and get that just to qualify.
It happens.
if you don't have diabetes or high blood pressure or sleep apnea, actually your BMI has to be above 40. So there's actually quite a few patients that come to see us that actually may not qualify just based on their BMI being too low. And that's, one of the, kind of bittersweet moments that I have when I see a patient and I just have to tell them, I'm sorry, but your BMI is too low, and you're just going to have to, you're just going to have to do it the way we all have to do it. And, the majority of Americans obviously have to deal with, their weight and their health through ways other than bariatric surgery, and so we help people with that as well.
I have a question for the crowd, and I know you can't see them, but we're actually in this big auditorium, and there's a fair amount of people here. So we've been talking a lot at our program. We keep talking about comprehensive, what support, what resources, what do you do? And I have kind of thought about doing something with the American Board of Obesity Medicine, which is prescribing medications, and having a new non-surgical medical program, which is going to be in conjunction with our other program. Would anybody here be interested in a non-surgical option? Okay. All right. So
A lot of hands went up, if you couldn't see.
yeah, a lot of hands went up. That's exciting. So that's great. So we would love, look, first and foremost, Dr. Friesen, Dr. Bello, myself, our whole team, we want to treat this disease. And I do think that surgery is the most effective tool, but it's not the only tool in the toolkit. And we want to help people with that. So hopefully, summer 2020 will have some really major announcements that can help anybody who wants to lose anywhere from 5 to 500 pounds or even more, and we can be your one-stop shop.
I think that's a plan. Yeah.
Okay, we have some excitement. All right, I'll keep studying. I'll keep
And
working.
another question as well?
Okay, so this is a two-pronged one. The first part is age a factor in whether someone should get surgery, and what is the death rate with these procedures?
Very, very good question. What is your age cutoff?
I don't really have one. I think the youngest patient I've operated on was 18, and the oldest probably in the late 60s, I would say. I know we've done some patients in their 70s.
Oh, yeah. I will go up to age 80. So I do 18 to 80.
Really?
Definitely.
Wow.
Yes, yes.
That sheds a whole new light on everything.
Yeah, it does. I had my oldest patient I've done, I think she was 76. You know who you are out there. And she's watching, I guarantee it. She's always watching. If people think that, like, oh, your older patients aren't going to be on social media, they are. So you know who you are. Hello. But yeah, we'll do up to age 80. And as far as the death rate, it is extremely low. It's a fraction of a percent, if that. Probably, I would say it's 0.1.
That's very low.
0.1, maybe. Yeah.
I mean, surgery is a risk. I think you hear that with any kind of surgery, an appendectomy. I don't care what it is, right? It's a little bit of a risk. But if you're healthy enough to have other surgeries, is that fair to say you're healthy enough to have bariatric surgery?
Yes, and if sometimes it's a tough thing because you're unhealthy because of your weight, and I need to do this to help your weight to get you not to be unhealthy. And so that's the tough thing.
Because you're oftentimes operating on obese individuals.
Always.
So you as surgeons must have to have a different mindset when you go in to perform a procedure.
Definitely.
Because all of your patients are coming in quote unquote unhealthy. Not just having to have something replaced or removed or, a gallbladder or something, but overall, systemically unhealthy. What's the difference for you as surgeons when you go into that procedure knowing that?
That's such a good question. Well, so Dr. Friesen does, he splits his time between doing the general surgery, so he can, okay. I only operate on morbidly obese patients. And so maybe, yeah, I'd be interested in your answer to that.
I mean, there are definitely different types of patients. When a patient is obese, their abdominal wall is much thicker. And so that does make the surgery, it's a different type of skill that you have to bring to the table, literally, to be able to do the surgery. There's some difficulties to doing surgery in a patient who's obese. Not just the difficulty of doing the surgery itself, but you also have to be more careful about certain other aspects. So one of the risk factors of being obese with surgery is blood clots. And so that's something that we have to be very careful when we're operating on someone who's obese. And one of the things that we have to do, for example, right after surgery is we have people walk 2 hours after surgery. And it sounds crazy after having a big surgery like a bariatric procedure, but we actually have people walk in the halls. If you go to the unit after surgery, unit 48, which is all our patients go, you'll see a big line of people walking around in a circle. And it's actually really inspiring to see because, this is the main way that you can prevent blood clots. And that's one of the aspects, but that's one of them.
We had a question too I wanted to get in because Craig, who shared his story, said he had gastric bypass 15 years ago. Could I be eligible for a revision? And can you explain what that is?
So revisional gastric bypass, we do not do here at GBMC. So I'm sure everybody knows somebody who had gastric bypass who didn't do that well. And mainly it was because 15 years ago, they did it a lot different. We talked about minimally invasive, which is how we do it now, and that's the way we've trained and the only way we do it. But in the past 15 years ago, he probably had a big open incision, so the visualization wasn't as good. Maybe the pouch size is bigger, maybe it's not perfect. There are providers in the area, Barry Green in Rockville, Maryland, Hopkins, University of Maryland, that do gastric bypass revisions. We don't do that, but we do.
What does that mean?
That means you would make like the stomach pouch tighter or smaller. There's also a bariatric endoscopist who could go down on the inside and try to tighten things up. I don't think those things are that effective. Sometimes you can take a bypass and reroute yourself back to normal and take you to a sleeve. There's a lot of considerations.
I would say the main revision that we actually do is converting patients who have a gastric band to another procedure. So often you can go from a band to a sleeve or from a band to a bypass. And the other revisional procedure that we do is going from a sleeve to a bypass. But most of the time it's not because of lack of weight loss. It's more as a treatment for reflux, which we talked before. So sometimes patients who have a sleeve can develop a little bit of reflux. And if it becomes severe enough, sometimes we have to revise it to a bypass.
And which leads me to ask you, do you still do the band, or is that not done anymore?
No.
So this type of surgery has come a long way in the last 15 years, it sounds like.
Absolutely. The equipment we get to use, the technology, we partner with industry, it's just so much safer and more effective and more efficient than it once was.
Have we talked numbers about actually how much weight people lose? I know it probably varies, but someone's going to come to you and say, Doc, I want to look just like you when this is all over. How many people say that? Come on. You know they say that all the time.
I love it when the student surpasses teacher, and that is, it happens. Some
good
people I'm like,
answer.
okay, they get down a lot lower than my size.
But I'm sure they say, how much weight am I going to lose? How much weight can I lose? How much weight is safe for me to lose?
So we describe it in terms of excess body weight. So if you should weigh 150, but you weigh 250, you have 100 pounds of excess weight. With the sleeve, you'll lose between 60 and 70 for every 100 pounds you have to lose. And the bypass is about 80 to 85 for every 100 you have to lose.
And is that a given, or is that you doing all the right things along with the surgery?
I would say, the initial weight loss. So during the first year, I would say the vast majority of people will lose a significant amount of weight. But the important thing is keeping that weight off, because most people we operate on, they're in their 20s, 30s, 40s. They still have most of their life ahead of them to live. And so what's important is what's going to happen 20 years from now, 30 years from now. And if you look at the statistics, the effects are actually long-standing. So even 20 years after having a sleeve or a gastric bypass, the majority of people maintain that weight off.
So, I think, which leads us to our next topic, which is how to do that, and sort of rethinking how you're living, your habits, and what you're eating. And that's why I know as part of your team, a nutritionist is so very, very, very important. And our colleague Don Scott gets a look at what we need to look for when we're buying food.
Along with a new year comes a new decade, new goals, and maybe even a new you. 2020 will also bring new food and nutrition labels that can help no matter who you are or how familiar you may already be reading them. I spoke with registered dietitian Jana Wolf, Director of Nutrition at GBMC's Comprehensive Obesity Management Program, to find out what changes we'll see on those new labels and how it will help us make healthier decisions. So we're not only starting off on a new year, but we're starting out that year with nutritionally with new food labels?
Yes. So bigger companies are required to put in place the new food label design by January 1, 2020. So here we are. There's some big changes,
Okay.
the old and the new. The only people or the only companies that are not required to do this just yet are the smaller companies. So you may see some old labels in the grocery store that are not yet switched over. But a couple of the big things that are going to be changing are the calorie size and the serving size. So this is really good if you're trying to watch your weight or trying to watch your calories. When you're looking at the calories, they will be bigger than the old label. So you'll be able to see them front and center. Okay.
Not more calories, but bigger.
Not more calories, but the actual font size is bigger. So you can understand what you're consuming at the time. But also, in addition to that, you have the serving size that's going to be slightly different. So this is the original label that you see on most products, and then this is the new label. Some products have already taken on the new label, but by January 1, 2020, all of the major food companies have to take on this new label. So you can see the difference between the calories, how much bigger in font they are than the old calories. Also, you'll see that calories from fat is no longer on the nutrition label. Added sugars are underneath the total sugars.
Okay.
Okay, added sugars are the things that are placed in the product from things like cane syrup, dextrose, high fructose corn syrup. They're the added sugars that aren't naturally occurring in the product itself.
Gotcha.
So I'm going to give you an example of this. So I know that we're well past Halloween, but when I look at this label, I see total sugars, and then I see added sugars right beneath it, indented. So your total sugars are 21 grams, but they added in 21 grams. So there's no naturally occurring sugar. It's all added.
It's candy.
Well, sure. So you know what you're in for, right?
Yeah.
But then what happens when you see things on the front label like made with real honey? These are marketing terms that people want to see and that marketers know people will buy into. So don't be fooled by that. Always look on the back. When it says made with real honey, you'd think that that might be the first ingredient. Well, no, the first ingredient is sugar and corn syrup.
So they've got a drop of honey in there and they can claim we've made it with honey.
Precisely. There's also an addition of vitamin D and potassium under the big bold line. These are the vitamins that we tend to ignore and not look at. But what we added was the vitamin D and the potassium because it appears that Americans are not getting enough of that in their diet. What was removed or unnecessary at this point was the vitamin A and C. They took that off because it appears that Americans are receiving enough vitamin A and C through their diet. I want to give you an example. So this is just your typical protein shake.
Okay.
See how the calories are a lot bigger than usual? And then this goes with 1 carton, so that's the serving size, 1 carton. So all of these numbers align with this 1 carton if you consumed
Okay.
it. Now, a difference that is going to be occurring in some products, if you could potentially consume the entire product, like I could sit down and probably eat this entire bag.
I could beat you.
Okay.
Beat you to the bottom of the thing.
So because of that, what they're starting to realize is that people will understand, yes, per serving, about 23 crisps would be 150 calories. But for the entire container, you also have the label that goes down 300 calories and everything else that aligns with it if you consume the entire container.
Okay, this one's not bad because that's only double, but I assume others are much larger.
Could be triple, quadruple, yes. So the serving sizes will be changing, which is nice, so you can be better educated when going into and buying certain products. Something that's going to be removed, calories from fat. So they've realized that consumers are no longer looking at calories from fat, so they took it off to make room for other items on the label. So you do have to look out and watch out for the marketing terms on the front. A couple of marketing terms that you might be familiar with are gluten-free, all natural, organic. These all sound great.
Yes, they do.
And you probably think that you're picking things out that are really healthful, and they might be, but you can still add tons of sugar, fat, saturated fats, and calories.
So are there any other marketing terms? You gave us like 4.
Made with real fruit, no added sugar, or let's say unsweetened. So you can see that on tons of fruit juices. Fruit juices can have the same amount of sugar as soda. So all of these things are things to consider when you're looking around. You might want to just turn the food around and look at that label for the total sugars and the added sugars. Another label that you might see on the front of a package is gluten-free. A lot of people go in thinking that gluten-free might be healthier or lower in carbohydrates, and usually it's not. Or sometimes it can have less nutritional value because a lot of the whole grains or the fiber is taken out of it.
When it comes to the marketing of food products, looks can certainly be deceiving. Janet telling me that just because it looks healthy doesn't mean it is healthy.
You know, we might think, oh, Raisin Bran Crunch might be better option.
Raisin Bran sounds
Right,
healthy.
Raisin Bran has over 100 calories more and 28 grams of sugar versus the 14 grams of sugar. So an interesting product is it'll say 100% natural flavors, but it's still, you know, for a whole bottle of this, 300 calories, and look at this, 80 grams of added sugar, 80 grams. Wow. So do not be fooled by 100% natural flavors. It does sound, you know, and caffeine free. Oh, this is, you know, with other natural flavors, this is probably a good product. You still have to flip it over and see, oh, 300 calories, 80 grams of sugar. Also contains no juice. So if you're looking for that juice,
That's amazing.
right, 159% of your daily value just from this one drink.
So there you have it. Next time you're out on your grocery shopping adventure, be sure to turn the package over to find out if those snacks are truly as healthy as they claim or you think. You may find some new, healthier alternatives out there for a new, healthier you, now that you've mastered reading those new food and nutrition labels. For GBMC Greater Living, I'm Don Scott.
Wow, I think we all just learned a little something right there. And but one thing I do know, sugar is the devil, okay? I don't think that's going to change, so that's probably number one.
Completely agree. So I know you all want some tips, and I hope you learned some things there. So like you said, sugar is the devil. Sugar is toxic, it's poisonous, it's awful. It is a drug, and it's an addictive one, and we know this. So what should you do? Number one, you've got to eat more to lose more. You have to eat breakfast, lunch, and dinner every day. Even if you're not hungry, even if you don't feel like it, even if you think that that's wrong, I'm right, trust me. Just eat breakfast, lunch, and dinner every day. Get organized, maybe do food prep that might help you. Eat protein first. Minimize the snacking, the picking, the grazing, the nibbling. You sit at your desk, let's say you have a boring job. Boredom eating, that's going to be a one that you're always reaching for something.
Stress eating.
Stress eating, emotional eating. I'm having a good day. I'm having a bad day. There's always reasons. That's the thing. We're all amazing at validating in our own BS. I'm just going to say it. We are. If we want it, we're going to have it. I need it because of this, that, or the other. I'm going to do it because he's doing it. He's not that big. Tomorrow we won't do it, and then a new day comes, and you end up in the same vicious cycle. You got to break that. Maybe, I know there's no magical time on when you should eat, but I think that chances are you're going to want to cheat later at night, so maybe make it so you brush your teeth after you eat dinner. You have to actually like break that seal to be able to start nibbling again. And you know how it is, you eat one chip, but you can't eat just one. That Ruffles campaign is very accurate. You're going to eat a lot. So try to stay away from it. And the number one thing, as she just showed with that bottle of Fanta there, was that you need to avoid drinking things with carbs, calories, and added sugars. That is the kiss of death. Even if I make your stomach this big, I'm still going to be able to get the fluids in there. Do not drink sodas. I'm a recovering cherry Coke addict. And by the end of each day, I didn't realize it, but I was consuming over 2 liters. Some of you are kind of shocked and grossed out by that, but some of you might be feeling me. It is hard to break it, just like with any drug, but there are certain things you cannot do in moderation. So you can't do heroin in moderation. You can't do sugar in moderation. And I'm not saying that you have to be punished. There are certain things you can do and can't do. And sodas is one I can never do again. Never do again. Don't do fruit juices. Don't do regular sports drinks. Alcohol has a lot of calories and carbs in it, and especially if you do sugary mixers, margaritas, all that kind of stuff. And it might sound like, well, what's life worth living for? Well, for me, my life wasn't worth being over for a can of cherry Coke. Just saying.
So can people come to you, and do they ever come to you and say, I'm just going to get this weight loss surgery, and then I'm going to be able to eat whatever I want in moderation? I mean, they still have to work the plan,
Definitely.
right?
It is not the easy way out. It's still a lot of hard work. Like you said, it is a tool. We will give you the tool manual. We will help you with it. I think we stress this and we offer these supports. I think that very few people actually think that way. I don't think that anybody that comes to see me is lazy. I don't think anybody sits there at home and eats pizza after pizza is just slob. That's the misconceptions out there. The people that come to see me are the ones that are fighting for their health and to treat this disease. And they should not be discriminated against.
And I know Janet is your star player when it comes to helping people eat beyond when they've had the surgery. But are you talking, I mean, are people eating more Mediterranean diet? Are they trying to eat more protein? What is the thing now? Because I think everyone's looking for what is going to help them. And also, can we just talk about the role hormones plays? I mean, I don't know how many middle-aged people come to see you, but once the hormones start to drop, it's a game changer. And everyone starts putting on weight, and then it becomes really difficult.
Yeah, it's especially difficult for women. 85% of our patients are female. And that is not unique to our practice. It is that way across the nation. We operate on a lot of people in their 40s and 50s, and I love that age group because it is at a crossroads of life. Some women are going to menopause, your metabolism is slowing down. It is much harder. And I think surgery is just the jumpstart, the springboard to help you to get to the top of that mountain that you need to get to. And it is hard.
And we get a lot of mixed messages, I think, too, about what to eat, when to eat, how to eat, intermittent fasting, keto diet.
You know, sometimes I think to step away from the scale and stop trying so hard and just follow the general gist of this. High protein. So go for your lean proteins. You want to try to avoid the fried foods and that sort of thing, the hot dogs, that sort of thing. You want to eat eggs are great, omelets, bacon, sausage, fine. All that's decent. Do that for breakfast, lunch, lean protein on a salad. Put the dressing on the side so you just dip it in. You don't do as much. Dinner, same thing. Then eat a lot of protein. Get filled up on it so you're actually satisfied so not 2 hours later.
How about healthy fats?
Healthy fats are fantastic. And I believe the
reason...
we
need like avocado, olive oil.
Exactly.
Coconut oil.
I think the problem with our epidemic, the obesity epidemic, is that we had this whole era where we said we needed low fats. So low fat, they replaced it with carbs, and it made it even worse. So
which
now
is
we're
sugar,
finding,
really.
Exactly. It's the added sugar, like Jana said, which is the problem.
Right. Another question?
So we have a bunch. I have one from Facebook. It is from, give me 1 second. Okay, my phone's not cooperating, so I'm going to do the one that is written on paper.
Sure.
So one of our audience members asks, society is glamorizing obesity with celebrities and TV shows and stuff like that. What is the health industry doing to change that mindset?
Boy, that is a fantastic question. I'm going to go there. So there's Lizzo, okay? So Lizzo.
I love Lizzo.
I love Lizzo too. Lizzo, I know this is random.
Do you know who Lizzo is?
Some of you do,
Okay.
some of you don't. So she is a female rapper who is overweight. And she gets up there and she talks about loving yourself and empowering yourself no matter what size and that sort of thing. And I think that message is important. However, I think that you should also glamorize the fact that your health is even more important. I'm scared for her and for others who might think that it's okay. It's not. And it's hard to come to terms with that you need some help in some way, shape, or form to get healthier. So, that is a good question, but
yeah, and you kind of
difficult
stepped
one.
into some controversy there.
I know
right?
I did.
You know that.
Lizzo, I love you. If you're watching out
because
there,
there are so many
let's
people who
talk.
feel
Yes.
they've been, demoralized by how they look, and so they just want to be accepted.
I know, and I just hate like the cover of People magazine. I'll switch it off of Lizzo. People magazine has half their size, no gimmicks like surgery. I wrote the editor of People magazine because that really irritated me, because it is actually discriminating against people who are just trying to get healthy and do the right thing. And I think, boy, it's difficult out there, but we need to stop glamorizing that and maybe start glamorizing bariatric surgery and some of the other tools that we have to help patients lose their weight.
Okay. And so the question on Facebook is from Ashley. She asks, what is the recommended daily nutritional caloric, carb, and fat intake for someone who's 1.5 years post-op?
Great question. So she wants to know about what she should be doing. So my number one thing about calories, don't know, don't care. I know that's surprising. And even though Jana said on the label the calories are going to be way bigger, don't care. I don't think it's about the type of calorie or the amount of calories, because if you look at a can of Coke, like she just showed, it only has 150 calories, which is not much. A piece of lean chicken breast that is grilled also has about 150 calories. But the sugar content, you just saw 80 grams in that bottle, that's the scary stuff. So don't worry about calories so much as the type. You want to keep your additional added sugars less than 15 grams a day, and you want to keep your total net carbs less than 50 grams a day if you want to lose weight. What is a net carb? It'll say the total carbs, and if it has fiber in it, you subtract the fiber, you subtract the sugar alcohols, you get your total number of net carbs, and you want to keep that less than 50 grams a day. If you want to maintain your weight, you keep that about 100 grams of net carbs per day. If you want to figure out how to calculate that, you can Facebook friend me, Elizabeth A. Dovek, and I will help you out and answer that better. And then fats is another one that we don't really look at. We want you to avoid the trans fat and the saturated fat.
You know, it's easy to put on 25 pounds. It just creeps up, and all of a sudden you look and you're like, oh my gosh. Do you think we should be stepping on the scale more and really know what our number is?
So as I study for this American Board of Obesity Medicine, they recommend that you step on your scale every day so that you can kind of know, so that that 25, oh my, I haven't
That's the
stepped on
first
in a
time
month.
I've heard someone say that.
I'm shocked too. I actually disagree with that. I feel like, especially in my patients, in the beginning, after you lose weight, very quickly after bariatric surgery, it is a honeymoon. It is euphoria. I stepped on, overnight I lost 5 pounds. It is that fast sometimes, and that's amazing. But then I think you can become obsessed, and then the more obsessed, like it's just like all-consuming. I suggest that you step on it once a week. I think that my patients who do that do the best. So you kind of keep it in check, but you're not obsessively doing it. And stick to that. Step away from the scale, people, because I think those who quit putting so much emphasis on that and towards their well-being, their mental health, will do much better.
But when you do step on, I think it's just kind of have to accept the reality of where you are, and maybe that's the thing that will.
That's the tough thing.
Because it's not looking, I think, that it starts to creep up, or you just don't want to deal.
I know, and it can be bad. It can set your whole mood. I mean, you know.
Oh, no doubt.
And we all know that. And
How many people have stepped on the scale and it just ruined their whole morning?
I mean, duh. And
Right?
then you're like, well, I didn't go to the bathroom yet. And
Right,
I'm wearing
right.
This belt weighs
Or you're
a lot.
taking off your ponytail holder, because I don't know what that weighs, but.
That's 3 pounds easy.
Exactly. Exactly.
I understand.
And use the same scale at the same time of the day, I guess that would
I
help
agree.
too.
Morning, never, ever. I think people who weigh themselves in the afternoon or evening are crazy. Only in the morning on an empty stomach. Don't even take that sip of water.
Where do you see, what would you like people to know, because we're kind of going to wrap up, and you've been so great about sharing all your knowledge.
Thank you.
What should people know about weight loss surgery? What have we not been getting across in the messaging of it?
So I have operated on almost 3,000 patients. I have seen and treated pre-op, post-op, those contemplating, those after surgery. In my career, probably about 4,000 to 5,000 patients at this point. I have seen people who are actively struggling with this disease. And like I mentioned earlier, I can see that it is possible to change the course of your life with this. The number one thing I hear over and over again is that I wish I would have done this sooner. There are so many studies, it's not just me saying this, that it actually, after a gastric bypass, for example, it adds 12 years on to your projected life expectancy. It can add longer years, but not only that, better quality years. So if you feel like you're out there right now, I'm gonna talk to you who's watching, and I hope that you still are. If you feel like, oh my gosh, I'm in a dark place, I'm really depressed, I'm really not living, I can't play with my kids, I'm not going to be able to be there maybe to see grandkids or to ride that roller coaster or take that plane ride or buy something, my goodness, from a regular store. There's so many considerations that make this so difficult. stop and look into this. Look, there's no obligation. I think you should explore your option and hear more information. Just go to our website, gbmc.org/weight-loss, and enter a few simple answers. We'll call you. I would love to talk to you one-on-one. You can friend me on Facebook, like I said. You can Instagram message me for anything. I will respond to you very quickly, because I want you to know that all of us here at this practice really do want you to do well. That's the beauty of a community practice. You're going to get me, you're going to get Friesen, you're going to get Dr. Bello, you're going to get all of us every time that you do this. And we will become friends. I consider Darla and Rick Smith my absolute dear friends to me. And I think that I would love to be your friend too and walk you through this journey.
Well, the stories are inspirational. I literally got tears in my eyes walking. When the models came down the runway, it was just, wow, really incredible. So thank you so much,
Thank you.
Dr. Dovak. I mean, just really, it's so great. We could pick your brain all day, right?
You can keep picking it.
Dr. Friesen, thank you so much for being with us. And really kudos to anyone who's trying to better themselves, who's trying to get healthy. It can feel like an uphill battle, but there's a whole community here to give you support. So thanks for being with us today, and we'll see you next time.
Thanks.